Good evening. I will be discussing the country of Uruguay and the cultural influences on personal behavioral choices as well as public behavioral choices that affect the country's public health, their major public health issues, and their health rankings. So, the country of Uruguay is a Latin American country located in South America that is known to be one of the most developed countries in South America and in the world. The reason being for this has a lot to do with their healthcare system. So, the country of Uruguay is regarded as having one of the best healthcare systems in the world, ranking in at number 39 out of multiple countries in the world based on different censuses that have been gathered, questionnaires, documentaries, um, hospital records, birth records, and death records. So, a country's public health ranking is determined by the quality of their healthcare system, as well as their healthcare infrastructure, their healthcare professionals, their staffing, the quality of the medicine available, and also the government participation in creating laws, legislations in order to further the development of public health and correct wrong behaviors or correct poor choices that negatively affect health. So, one of the reasons for Uruguay being regarded as having one of the best healthcare systems in the world is because it employs about five doctors per 1,000 patients. Why, while this may seem as a very off ratio, it actually means that the country and its hospitals and healthcare facilities are actually well staffed. With all the public health and healthcare resources available to the people of Uruguay, there are still some glaring issues in inequalities in their healthcare system that account for lower than optimal healthcare rankings, as well as greater disease and risk in the citizens of Uruguay. So, based on the research that I've done and conducted about the health barriers, I believe that the most common reason for poor health in the country of Uruguay has to do with behavioral decisions. Yes, there is a great healthcare system in place, but healthcare professionals, facilities can only do so much. They have to they have to be they have to be used and incorporated into the daily lives of the citizens. The citizens have to know what healthcare options are available. They also need to know what choices affect their health, whether the positive and the negatives. And that's the reason for failing health in Uruguay. So, the country of Uruguay has been occupied by several different nations throughout its long history. It was originally conquered by the Spanish and the Portuguese, but there's also been different influences from North America, from different countries in Europe that have all affected its culture and its different traditions and lifestyle choices. So, the three lifestyle choices that I've identified to be the most detrimental to the country of Uruguay and is accountable for many of its health issues is the overconsumption of alcohol, the overuse of tobacco, and also the overconsumption of beef, red meat. While these may all seem like common occurrences throughout the world, the rate of use in Uruguay is an alarming rate. And this contributes to poor health because the effects of the overuse, overconsumption of these items, products, goods include heart disease, liver disease, diabetes, hypertension, a host of diseases that are essentially preventable or manageable based on good health choices. The country also has an alarming rate of different cancers stemming from the smoking of tobacco, from the diseases of the liver and the intestines caused by overconsumption of red meat, or diseases of alcoholism. But these are all a part of the cultural experience of Uruguay that's been influenced through the settlement of European nations. So these choices, while common in the country of Uruguay, aren't seen as a problem because they are deemed to be factors associated with status and wealth. So if you're able to consume alcohol, purchase alcohol, smoke tobacco, eating a lot of red meat, then you're considered to be of a higher economic status. You're able to have a greater wealth. You're able to achieve more, do more. And that's the sort of perception that the citizens of Uruguay have. So the more that they indulge in these activities, the more that they are seen as higher members of society. Therefore, in an effort to correct these poor choices, I've developed a SMART goal that by the year 2030, that the citizens of Uruguay will be able to live longer, healthier lives and have less outbreaks of diseases by correcting their choices. And these can be measured by yearly census and yearly questionnaires that will gauge the effectiveness of relief programs. So, the relief program that I have in mind is based on education. Most of these, again, are behavioral choices. And the only way to change human behavior is to first study the human behavior. So, by looking at what are the causes of human behavior, the social determinants, what makes the citizens of Uruguay choose to live a certain lifestyle, make these certain choices. After that is thoroughly researched and discovered, then a plan can be put in place. Once you know what the determinants of behaviors are, then you can make the appropriate interventions in order to change those behaviors. And we want to make sure those interventions, they're permanent. We don't want a temporary change and then behaviors and choices revert back to their original and we see another decline in health. So that's why the first step is determining what is the cause of these behaviors so we can find out how we change these behaviors. Next, through funding by Uruguay's government as well as other foreign bodies, relief agents, UNICEF, the World Health Organization, and through local community volunteers, we can begin the process of educating the people of Uruguay on their choices. A lot of times, when we do make choices, we make those choices without knowing the full scope and the after effects of them. So, by educating people, we can let them know what are the risk factors associated with their choices and give them the opportunity to make those correct choices or correct those incorrect behaviors. An important part of this program is the utilization of local volunteers because it might also seem invasive when you have a bunch of foreign people, whether they're professionals, healthcare professionals, or health workers. It might seem invasive to have strangers trying to tell you how to live your life, how to make certain choices. So that's why having locals who are able to connect with the people who are part of the culture, who understand the motivations behind their fellow citizens' choices, that they can help them steer them into making better choices. Also, another important fact is that in 2006, Uruguay became the first Latin American country to ban the public smoking of tobacco. And that's a huge step in correcting the bad behaviors associated with smoking and diseases such as lung cancer, strokes, heart disease, cardiovascular disease that are associated with such activities. So the key partners of this product of this program would be the government of Uruguay, uh, like I said, foreign bodies, the World Health Organization, the CDC, the National Heart, Lung, and Blood Institute. And the main focus of this program is to educate the system on their lifestyle choices, help them to make better choices, help them to see what the effects of their choices are. The key resources will be the volunteers who are able to connect on a cultural level with the citizens of Uruguay and able to better affect change. And funding will be provided by mostly the government as well as aid from other foreign bodies, agents, and through fundraising, and also an additional aspect will be creating incentives for change. So we know that there are a lot of negative behavioral choices. So the overall presumed budget for this program would be about $2 million. This would focus on paying volunteers as well as setting up different conferences, lectures, also providing incentives. Incentives could be in the form of monetary gain for the citizens if they adopt this change. Then, with the implementation of all these educational programs, incentives, then the next step would be to measure the effectiveness of these programs by conducting health surveys, taking a census, as well as observing hospital records, death records to show how the citizens of Uruguay, how the mortality rate or morbidity rate has either increased or decreased since the implementation of these new strategies and programs. However, if all these programs are done successfully and we have the full support of the government and the people, then we should be able to correct the negative influence correct behaviors, and stop these common diseases that are caused by poor lifestyle choices, and thereby increasing the health rankings of Uruguay and its people. Thank you for your time. I'm Zane Man, and thank you.